Topic of this presentation is cocaine. The primary prevention level is to educate young adults about cocaine, while a tertiary prevention level is to introduce versatile methods to help prevent or stop the overall use. This will be presented by Jasmine Henderson, Jordan Genus, Kylie Husband, Madison Horn, and Rainey Henderson. One of the main questions about a drug is what makes them so addictive. So what makes cocaine addictive? And the answer is dopamine. Dopamine is a neurotransmitter that is released from the brain to signify pleasure. Dopamine gets recycled back into the neuron to encourage a repeat of the pleasured activity. The way addiction and dopamine works is that cocaine blocks the dopamine from being reabsorbed back into the neuron. This causes a flood of the neurotransmitter in the brain, which leads to the high feeling from cocaine. This will increase appetite and fatigue, which increases the impulse to take more of the drug. And continuously using cocaine will cause the brain to stop making dopamine, which causes more of a dependency, which is how cocaine becomes so addictive. Now it's time to discuss how cocaine affects one's health. One of the most dangerous impacts cocaine has on the body is what it does to the brain. Now, the brain has this tissue that's called gray matter, and it's something people lose as they age. And this gray matter that people lose is what causes mental issues like confusion and short-term memory loss as you get older. Well, when you abuse cocaine, you lose the gray matter at a rate twice the amount as seen in healthy people, which means your brain basically ages much quicker than it would as if you weren't using cocaine. So in the long run, cocaine abusers can struggle with cognitive things much earlier in life, and it can affect the way someone works, raises children, or handles their simple everyday hassles. Another way cocaine can impact the body is the way it damages the blood vessels. A small dose of the drug tends to make blood vessels constrict, which causes the heart to work against resistance. Blood begins to pool within the body, which can lead to blood clots, or it can prevent the cells from receiving nourishment from the heart and being unable to get rid of necessary waste. Because there's something blocking its pathway, so there's no way for it to flow. And this is what causes cell death. And the blockage from the blood clots can reach the brain, and this is how people who use cocaine get strokes, is because there's an interruption of blood flow going to the brain. And this can be very painful. It can start with a twinging feeling in the chest and getting pins and needles in the fingertips. And most common symptoms for a stroke is feeling the sides of your face droop or feeling numb, receiving speech difficulties, and getting muscle weaknesses on one side of the body. And down in the corner of the presentation slide, there's a picture of what a blood clot looks like, and it's when the blood gets in gel-like clumps and it just forms in a big ball and it blocks the flow pathway, and this is how it damages your blood vessels. Another important way cocaine impacts the body is what it does to our gastrointestinal tract. And as background information, the gastrointestinal tract helps the body pull nutrients from food and expels anything the body doesn't need. And the important thing is that it's dependent on blood flow. And as we learned in the previous slide, cocaine affects our blood flow by the impact it has on our blood vessels and how it causes blood clots, which is what can lead to strokes and what can lead to cells dying. And since cocaine affects the cardiovascular system, it has a ripple effect in the gut. This is where blockages occur. And blockages will cause someone to experience episodes of abdominal swelling, vomiting that can lead to dehydration and to shock, and it'll increase the risk of tissue death and intestinal bursting. Since the digestive system is not receiving blood from the blood clots and the damaged blood vessels, it causes the system to completely break down. And some may experience gangrene, which is death of body tissue, and it's caused by reduced blood flow and a slowed down immune system. So cocaine affects one thing, which has a ripple effect on different parts of our body, because having the blood flow blocked by these blood clots and having these cells die from the use of cocaine doesn't just affect the gastrointestinal tract, it has more effects to our body, but these are just some of the main immediate responses that we would see. And in this picture shown in the bottom, the abdominal aorta and the superior mesenteric artery and its branches and the inferior mesenteric artery and its branches, those are usually where the blockages occur. And around that is where the intestines would burst, and there are pictures of intestinal bursting, but they're very gruesome, so I decided to leave them out. Now, these are just some of the risks cocaine has to our health and to our body, and cocaine can lead to addiction, obviously, but from this addiction can lead to an overdose, and overdose can possibly lead to death. Cocaine can cause an HIV infection. Usually this is if you're sharing, like if you're injecting it into your body and you're sharing with other people. That's one of the most common ways to receive this HIV infection. It can cause hepatitis B or hepatitis C. It causes mood disorders like feeling anxious, feeling violent, feeling depressed, getting psychosis or dysphoria. You can get cardiovascular disease, which is from the heart, blood not being able to flow. You get respiratory illness. You'll get a gastrointestinal disease. It can cause high blood pressure. You can eventually lead to polydrug use, which is multiple drugs at one time. It can lead to a stroke from the interference of blood flowing to the brain. Usually causes weight loss because this is when you lose your appetite, so you don't eat and you become too addicted to the drug to really have an appetite for anything. It can lead to seizures because there's no blood flow going to the brain, and it can alter your sleeping patterns because you'll feel tired at different times or not tired at all. It can cause memory loss from the gray matter that's being destroyed. It slows your reaction time. It shrinks your brain size. It can lead to nosebleeds, which is one of the most common ways to do cocaine, is to snort it up your nose, and that can make it bleed, or it can even cause your nose to collapse. And these are the main risks cocaine can have on the body.
Hi, my name is Madison Horn, and I'm going to be going over the short-term and long-term effects of cocaine use. I want to start out by saying that cocaine has a short-lived, kind of like an intense high, but it also is immediately followed by the opposite. You're going to get an intense depression, edginess, and a craving for even more of the drug. People who use it often are more than likely going to experience a loss of appetite. They're not going to eat properly. They're not going to sleep properly. They're going to have a greatly increased heart rate, which means you're more susceptible to muscle spasms, convulsions. It can make people feel paranoid, very angry, hostile, and anxious, even when they aren't even specifically on the high of the drug. So, regardless of how much the drug is used or how often, cocaine increases the risk that the user will experience a heart attack, stroke, seizure, respiratory failure, basically breathing failure, and any of those things can result in death. So this is a really serious matter, and now that I've kind of given you an overview of the short-term effects, the next slide I'm going to go into depth and list out all the short-term effects of cocaine. Okay, so now we're going to list out those short term effects. Some of these we've already talked about, but I think it's important that we make sure we go back over them. And also keep in mind that some of these effects can happen even after just one use. It's not something that has to be seen, after a long period of use or a certain amount of the drug. No, I can promise you some of these will happen after the first use. So let's keep that in mind. So we're going to start out with loss of appetite, increased heart rate, like we talked about, increased blood pressure, body temperature. You're going to have contracted blood vessels, increased rate of breathing, dilated pupils, disturbed sleeping patterns, like we talked about, nausea, hyperstimulation, bizarre, erratic, and even sometimes violent behavior. This is one of those drugs that have been known to cause violence in people. You can have hallucinations, hyperexcitability, irritability. So there was one thing that I found that was kind of new to me. Most of these I kind of already knew about, but one of the symptoms that I found, side effects that I found from this was actually a tactile hallucination in which it feels like there's actually bugs burrowing under the skin. And I'll have to do more research on that. It was kind of the first time I came across it, but I thought that was pretty interesting. Just kind of a branch off that tactile hallucination. So as far as anything else that we have, we're going to have intense euphoria, anxiety and paranoia, depression, intense drug craving, panic and psychosis, convulsions, seizures, sudden death. I'm telling you, that can happen just after the first use. And then obviously it's going to cause heart, kidney, brain, and lung damage. And going back to the one side effect where it said intense euphoria, I think this is an important topic because sometimes just the fact that it does produce that intense euphoria kind of gives people leeway. Like that's what people look for when they want to do cocaine. They're like, we want to do it because it does provide you that euphoria. And that's what kind of gets addicting about it. But I think they need to be educated on these short term and long term effects because they need to understand that the risks in this situation are always going to outweigh the benefits. Okay, so now we're going to talk about the long term effects of cocaine. I think the number one thing that surrounds this aspect of it is the actual addiction part because you're going to build a tolerance to it. And as your tolerance to the drug increases, it becomes necessary to take greater and greater quantities to get the same high as you did the first time you took it. So, this is important because prolonged daily use is going to cause sleep deprivation, a loss of appetite, you're going to lose weight. We kind of talked about those and we'll go more into depth of the long term effects. But my point being, with that prolonged daily use, a person can become psychotic, they can experience hallucinations. And this is because cocaine interferes with the way that the brain processes chemicals. So people need more and more of this drug in order to just feel normal. People who become addicted to cocaine, they typically lose a lot of interest in other areas of their life. And I think it is just because once you are addicted to it like that, you'll necessarily do anything to get that drug. So it just kind of puts you in a bad position. And I want to go into depth. So the next slide will go into depth as far as listing out all those long-term effects. Okay, so now we're going to be talking about the long-term effects of cocaine. Cocaine can be consumed in different ways. You can sniff it, snort it, or inject it. If you sniff it, you're going to have destruction of the lining of your tissue, the tissue lining in your nose. If it's smoked, you're going to have respiratory failure. And if it's injected, you are so susceptible to infectious diseases and abscesses. So along the other lines of permanent damage in other places, you're going to have permanent damage in your blood vessels, and that's going to obviously negatively impact your heart and your brain. You are going to experience malnutrition and weight loss, like we talked about, severe tooth decay, not attractive, right? Auditory and tactile hallucinations, sexual problems. So you're going to have reproductive damage and infertility in both men and women. Disorientation, confused exhaustion, irritability and mood disturbances, increased frequency of risky behavior. I'm assuming that kind of stems along the lines of the violence. delirium or psychosis, severe depression, and a tolerance, and obviously the addiction, I think, is the number one thing because once you're addicted, you're going to be experiencing those long term effects, and it's going to be to the point where it's going to be life threatening. And I want to tie this all back in and back to one of the short term effects that we talked about, the intense euphoria. So, overall, now that I've given you the overview and the details of the short term and long term effects, I just want to say I think we need to further our education in it because, like I said, we need to get the public to understand that the risks are always going to outweigh the benefits. And until um, students, college students, this especially this age group understands that, I think we're going to have more problems with it. So I really just want to get people to understand the importance of education in this aspect, both short term and long term. Because, like I said, it doesn't take you to be addicted. It doesn't take you to have prolonged use. These things can happen after the first time. Thank you.
Hi, so my name is Rainey, and I'll be talking about statistics having to deal with cocaine. So my first thing that I have going on right now is a chart, and it has the national overdose death rates. So the number of deaths involving cocaine is what this chart is talking about. It has the total number, which is in blue, and then the female, it's a line, which is in yellow, and the male, which is a line as well, and it is in orange. The chart starts off at 2002 and goes all the way to 2015. Throughout the chart, we kind of see an upwards and downwards trend. So from 2002 to 2006, we see an upwards climb of death rates in the United States dealing with cocaine. And then from 2006 all the way to 2009 and 2010, we see a bit of a plateau that has to do with death rates in the United States. And then from 2010, it slowly rises in 2011, and then goes down just a bit in 2012, and then from 2012 on, it's rising for total death rates up to 2015, with total death rates hits 7,000 people a year. So that's for total death rates. And then for the males, we actually see the same effect that is happening throughout the entire chart with the totals as it is with the males. Like, they coincide really well. Like, when there's an up, then there's a down, and then there's back up again. And they stay about a total of, they range from about 4,000 to nearly 5,500. That's about the death rate for men. The number stays between, but the female death rate is substantially lower than the males. The females stay at about 1,200 consistently. They're about a straight line across. There's not much fluctuation between the women in this chart that we can see with deaths involved in overdose with cocaine, which I find very interesting, that the women don't fluctuate as much as the men whatsoever. So. Statistics. 756 metric tons of cocaine have been confiscated throughout the world. 756 metric tons is about 7 blue whales, one of the largest animals on Earth. A total of $400 million of cocaine is produced a week in Colombia, which is their main exporter. 1 out of 4 people have used crack cocaine in the United States. More than 1 million people ages 18 to 25 had tried crack cocaine within the United States. The United States is one of the largest consumers of cocaine, buying over $28 million a year in the product itself.
Cocaine addiction can be treated in many ways. Most commonly, it's treated as an inpatient, which means the person checks in to a facility and they receive group therapy or individual therapy, medical monitoring, or treatment for chronic conditions that are resulting from cocaine usage. And also, they receive like coping strategies, how to, when they finish, when they're free of their addiction, how to cope with it when they get out back into the workforce or back into school, things like that. Currently, there are no magical medications that you can be put on to treat cocaine addiction. For a lot of addictions, facilities in Lufkin use methadone, which is pretty common. But you can't use that for cocaine addiction for some reason. There's also a 24-hour hotline that SAM HSA offers, and it connects people with local counseling. So it's not a hotline that connects you to a therapist instantly or things like that. It's a hotline you call and you say, I'm having a struggle, I'm located here. And they say, all right, 5 miles from where you are, there's therapy. Or 5 miles from where you are, there's an addiction treatment center. Things like that. So the person doesn't have to call the hotline every single time they need a therapist. They call the hotline once, they find treatment centers that are local, and they're given the option to attend those, which is amazing. Counseling and group support are subjectively the most effective treatments. Patients note that receiving group support helps them stay clean, get clean, stay clean. They feel like they have somebody to relate to. They have somebody who's struggling alongside them, and they're not alone, which is a big thing. Individual therapy is also just as effective, and half the people prefer group therapy and the other half prefer individual therapy. I say this information is subjective because there isn't necessarily statistical data that supports whether or not it's effective. It's just those who have gone through the treatment process say that they prefer group therapy. Okay, so now we're going to talk about the difference between inpatient and outpatient treatment programs. Inpatient treatment programs are time limited, so the person checks in for 2 weeks, 6 weeks, 8 weeks, whatever kind of program they've chosen, and then at the end of that, they're given the option to transition into outpatient. Outpatient just, at the end of the inpatient, outpatient allows a long-term, easily accessible treatment. Following withdrawal management process, a lot of people will continue the long-term treatment as part of an outpatient group, or a partial hospitalization group. Partial hospitalization is like they check in for a night because they struggle, and then they attend group therapy, things like that. So they're not admitted for weeks at a time. They're admitted 24 hours, 48 hours, things like that. It is important for those who enter cocaine addiction treatments to really know their options. They do not have to attend inpatient, and as far as young adults, a lot of them are very busy, but they want help, and so they can only attend outpatient treatments and still have effective care. It's also important that the person entering treatment wants the help. Those who are forced into it are less likely to have good outcomes. Outpatient treatment allows the recovering individual to live at home throughout the treatment. So, for instance, they go to work, and when they get off work, they go to a group therapy session, or they go to school, and when their classes are finished, they go to a coping skills workshop, things like that. So there's no requirement to attend. There's no length of time that they're admitted to a facility and required to attend these sessions. These are strictly, come as you are, stay as long as you want situations. A lot of people are given the option between individual and group therapy. Research shows that they're both effective. A lot of people prefer group therapy over individual therapy, but those who choose individual therapy like that it's more focused to them as a person, and they feel more confidential. They feel more safe, as in they can talk about everything that they're thinking. Whereas in group therapy, they feel more restricted. Group therapy, however, offers a support system. So most young adults need other people around them. They need that kind of social outreach situation where there's somebody who's going through this as well, and they can talk about it, and they have somebody they can relate to, and somebody that they feel like struggles alongside them. Both are equally effective. The person, who attends group therapy doesn't necessarily have a better outcome than the person who attends individual therapy, and vice versa.
Drug testing is used in several different places and for several different reasons. I'm going to be talking about why it's used by employers and schools and the benefits of using it in these two instances. It's used to discourage employees and students from alcohol and illegal substance abuse. This can be new employees, current employees, new students, current students. Employee-wise, it's usually used in the hiring process. They use it as a pre-screening measurement to ensure that they're not hiring someone that is currently abusing alcohol or illegal drugs. And in school situations, it's used to test students that are involved in any UIL events or teams. And it's also used in behavior situations, or if there was an accident on campus or anything like that, the student may be screened for drugs to figure out if drugs came into play in the situation and why it happened. It helps employees filter through applicants while going through the hiring process, because no employer is going to hire a person that is actively abusing drugs or alcohol. And it can help employers and schools be able to identify a problem and seek help for that individual before it's too late. This can help with intervention and treatment of this situation. And it's also used to ensure that schools and employers are in compliance with state and federal regulations, because illegal drugs are illegal, and so finding out who's using them so that the employer or the school is not at fault is a big priority. Drug testing is used in several different places and for several different reasons. I'm going to be talking about why. So there's many different ways to administer a drug test. The most common is urinalysis. This can be done almost anywhere, at the doctor's office, at the employer's, the school, or any site chosen by the administrator or the person giving the test. The applicant will provide a sample of urine to be tested. It will be put in a container and then sent off to a lab to test for the presence or absence of drug metabolites in the urine. This tests for amphetamines, THC, cocaine, opiates, and PCP. This is the most common drug urine test. So you can get other urine tests that test for more, but most of the time it's these 5 drugs. Different precautions are taken before the test is administered, so there may be blue dye in the toilet, or they turn off the water at the site so the applicants can't water down their sample, because the more water that's in the sample, the less likely it is to pick up those metabolites. And they also usually provide supervision by the administrator. Another form is a hair analysis. This is when they actually take a hair follicle from the test subject and they get that tested for these different metabolites. This can reveal if the subject has used drugs in the past 90 days. So these are more popular in probation and court situations because it can go back further. The urinalysis only looks for the past few days, and these actually go back up to 90 days. And so they're more necessary when it's very serious to know whether or not this person has been using drugs. These are also a lot more popular because the privacy issues are decreased, because this is the least invasive form of a drug test. So they don't have to worry about privacy policies as much. And the last way is the oral swab, and this is where you take a cotton swab or a different form and you swab the inside of the cheek most likely, and that will look for those drug metabolites. It's not as popular because it can only determine for the last few hours really, but it's more popular for anything that they need to find out in the moment. So like workers' compensation claims or injuries on the job will most likely use this form because it is better at telling whether or not that person is on drugs at the moment. There are several benefits for drug testing in these two settings. The benefits for workplaces conducting drug tests are the reduction in injuries. So in several studies, they've noticed that when drug tests were used and employees were constantly being checked for drugs or being supervised on drug use, that they reported less injuries and the worker compensation requests actually decreased significantly. It also lowered the absenteeism rate, so there were less absences after the drug test came into play than before. And most of this is accredited to drug use can cause absences because people are just out using drugs, so they miss their alarm, or they just don't come to work, or they're not as inclined to come to work. They don't feel as motivated. So the absent rate actually went down. And in the long run, this can actually save companies a lot of money because the medical claims will lower with less drug use, and less absences mean more productiveness and more ability to make money. You have more people there, you're making more money. The benefits for school conducting drugs tests is they're able to identify students with a problem. A lot of time you are not able to provide any intervention or treatment to a student unless you have proof that the student is using drugs. And these tests aren't going to find just one-time drug users. They're going to find people that are habitually using the drugs because the metabolites won't show up in a person that used the drug one time versus a person that uses it multiple times. This can reduce the drug use in students because of being able to provide treatment, and it can also, it helps because it's anonymous. So these students are not just picked out of class and everyone knows that they're going to take a drug test. It's a random pick of a student, and then they're taken to a second location to take the drug test and remain anonymous unless they decide to disclose to other people that they were drug tested. And this is very helpful because a lot of students that are on drugs are not going to ask for help, and they're not going to ask for anyone to get them treatment due to the stigma and just being embarrassed. So this anonymity will help them receive the treatment that they need. Using cocaine can provide several social consequences. One of the main ones is false friendships or confidence. The drug use can lead you to interacting with more drug users, and this can give the user the feeling of having a friendship with this other drug user that is not actually a true friendship. This is a very false friendship, and once those drugs are taken out of the equation, this friendship won't last very long because it has been built around the use of the drug cocaine. They will also notice that the users that they make these friendships with, they don't have the same personality or friendly feelings towards them once the drugs are not involved. So cocaine can also cause a user a high that makes them feel that they're on top of the world, hence the false confidence part of it. This can cause several awkward social interactions if this person feels that they are above someone else or their confidence is very high. It can also lead them to do things that they would not normally do and put them in some very serious situations. Another social consequence is the inauthentic connection. So the connections made are disguised as genuine, authentic connections. So, for example, a drug user or a user using cocaine could be at a party and they could feel that they are genuinely connecting with another person, having a serious conversation, or just discussing different subjects, and in reality, they're not talking about anything of importance, and they will not continue to be friends outside of that lifestyle once cocaine is taken out of the equation. A third social consequence is anxiety. Cocaine brings a level of anxiety in its users that may cause them to become obnoxious or get easily distracted, and that makes it very hard to be social or hold a conversation with anyone else while you're using cocaine. And users may become moody, irritable, and anxiety-ridden as they come down from the drug. This can cause more social awkwardness or even complete withdrawal from social situations. And lastly, a social consequence of cocaine is a selfish motive or several selfish motives. It can make a user particularly selfish and self-centered. So this could look like the person putting cocaine above all others, family and friends included. That could be this person looking for their next high and not really, or actually completely disregarding anything that they have to do with their friends or family. Like maybe there's a big family event and they completely skip it because they're worried about cocaine more than that family event. It makes them very insensitive to their friends or family, and they focus more on how to score the drug rather than keeping these close relationships with the people in their lives.